Hello, my name is Sheryl Carson and I work for Thomas County Extension in Colby, Kansas. And this talk, Master of Memory, is in cooperation with Texas A&M AgriLife with K-State Research and Extension. Have you ever thought, I am losing my mind? Because you've been in a situation where you were trying to think of something, you couldn't think of it, maybe it was a person's name, and you know that person very well, and for whatever reason, it's not there. And it's embarrassing, and you don't have time to reach into the back of your mind and find that name, and so you think, am I losing my mind? Or even worse, am I going through dementia? Do I have Alzheimer's disease? Well, I'm here to let you know to not worry about dementia or Alzheimer, because everybody forgets something at some point in time. But the older that we get, yes, we do tend to have some problems remembering things, and that's what this session is all about. What can we do to remember things a little bit easier, and why do we forget? What are those aspects of memory that help us to remember things? I'm going to tell you about those right now. Brain power, that's where our memories are at. And once in a while we'll get that senior moment. You know, you might say, I'm sorry, I forgot your name, I'm having a senior moment. Everybody has that. It's that brain lapse that finds ourselves being embarrassed, or you know that you should know it, even if somebody isn't around and you're just really trying hard to remember what that information was. And we might say it's just my age, and it could be. Like I said, everybody forgets, but unfortunately, the older we get, the more likely we are to forget something or not be able to retrieve that information as quickly as we would like. There are three aspects to memory. One of those is intelligence. Another one is learning styles. Another one is short-term and long-term memory. And I'm going to go over each one of those and explain those. Keep in mind that our memory can only be as good as the information that our brain has available to us. So if we never learned it in the first place, it's not going to be there to remember. There are two kinds of intelligences. One of those is crystalline intelligence. That's an intelligence where we have experiences from the moment we're born. All of the experiences that we have, the things that we learn, the people that we meet, our emotions that we go through, all of that is saved and is accessible to our brain. It's there, available. It's like think of a diamond that's hard and clear. It's there for us to use as we grow older. And in the use of that, we gain wisdom, we use it to make judgments, have experiences that we can turn around and use for each year of our life that we were not able to use earlier. And we call that crystalline intelligence. Fluid intelligence is the other one. Fluid intelligence is that information that we have quickly available to us, our ability to retrieve it. It's fluid, unlike the hard crystalline diamond intelligence. This one is not as dependable, it's not as stable, and it varies throughout the day, or it may vary even as we age. That one is the one that probably gives us the most trouble. It's the fluid intelligence that we rely on to access the crystalline intelligence that our brain has stored up over our lifetime. There are three types of memory besides our crystalline learning situation, our fluid memory. We also have sensory memory. Sensory memory is that information that bombards us nonstop 24 hours a day. It's like driving down the highway and having all those insects hitting our windshield. And sometimes it can be overwhelming. Our brain cannot handle all of that. It would simply become an overload if our memory remembered all of that. And so our brain will, just like our windshield, be able to wipe off that windshield with the windshield wipers. Our brain is going to make some decisions. It's going to decide, is that sensory information necessary or not? What am I going to do with it? Am I going to save it or not? So most of it is going to be wiped away. It's going to be deleted. We're not going to remember it. If our brain decides that the information is important enough, then that information is going to stay there for a few seconds at least, maybe a few minutes. And at that moment of time, what we will end up with is what we call short-term memory. That short-term memory, once it stays in our brain for at least, say 7 seconds, it gives us, even though you're not aware of it, it gives us some time to think it through, to do something with that information. And the longer that we can do that, the longer that we hold that information in short-term memory, the more likely it's going to stay. At some point, our brain is going to decide whether it's worth keeping or not. If we've had time to remember it, to go over it, let's say somebody gives you a telephone number and there's 7 numbers there, which, by the way, is the number of items that our memory can hold at any one time. We will rehearse it in our mind. You might say it out loud. You might write it down. Each time that you can do any one of those actions, you're more likely to remember it. And then it will flow into what we call long-term memory. Now, long-term memory is the information that gets stored in our brain cells somewhere in the back, and it's pretty much there forever. Unless you have a brain injury that destroys it, it's there forever. Unfortunately, we cannot always access that information, or not access it as quickly as what we would like. And that's where one of those situations where you know that person's name and you want to say hi, and then you can't remember their name. Well, the name's there, and your brain needs a little bit of time to go through that, and that's where the fluidity comes in at. You may actually not be able to retrieve that information until, let's say, in the middle of the night. Have you ever had that situation? You've gone to bed in the middle of the night, you wake up and you go, oh, now I remember, that was Bob. How could I have forgotten his name? So it was there, you just were not able to retrieve it as quickly as you wanted to. Now, we do have 3 types of learners, and each one of us has a preference for that, and I would like to tell you a little bit more, share with you the 3 different types of learners. But let's take a moment to stop.
Your home's exterior is the best defense against harsh weather conditions. With insulated vinyl siding, energy-efficient windows, spray foam insulation, and metal roofing from AquaShield Roofing and Construction, you can protect your home from howling winds and ice-cold temperatures. Don't let Mother Nature interfere with the comfort of your home. Call or visit us online today for a free estimate. AquaShield Roofing and Construction. Our team is dedicated to your complete satisfaction.
Make a difficult choice an easy one with Cedar View Assisted Living's knowledgeable and caring staff. Your loved one will be professionally taken care of as they transition into their new community. With movies, holiday parties, planned exercises, and games, residents will have opportunities every day to enjoy their time at Cedar View. Multiple room styles are available, ensuring a just right fit for your loved one. Come see Cedar View Assisted Living for yourself next to Sternberg Museum. The care you need, the home you want.
$10,000 in 10, but I give 50.
With 7 agents in 3 locations, Hammett Land and Auction Incorporated can meet your every need when it comes to your next sale. Visit them at hammettauction.com and you'll find all their upcoming sales, including farms, ranches, as well as farm equipment and even real estate listings, both residential and commercial. They've been serving western Kansas since 1983, and with offices in Stockton, Russell, and Hayes, they're always nearby to assist you. Hammett Land and Auction Incorporated. Contact them today.
Keeping healthcare close to home. That's the focus at Norton County Hospital. With 130 employees and 8 medical providers, we offer a wide range of services.
I'm one of the doctors that delivers here, and quality care for the mother and infant is one of our top priorities.
Patient care is also available through family clinics in Norton and Logan.
Our team works hard to reduce the stress of travel for patients by providing as many local services as possible.
The Norton County Hospital, dedicated to caring, commitment, and community.
Welcome back. Now I want to tell you about the 3 types of learners. And as I said before, each one of us has a preference for one type or another, although we do use all 3 of those. One of those is auditory. Some folks do prefer learning through hearing. They're more auditory. They are the ones that are more likely to dominate a conversation. And I'm sure you've noticed those people. They are important to the conversation, they share a lot, but sometimes they can even dominate. But that's their comfort level, that's them. They also are the type that do not like to write because they're not kinesthetic, they're not visual learners, they're auditory. So they would rather learn their information through hearing. Another one is visual. Visual people are those who want to see the information. I'm one of those. I like to see it. I am not an auditory person, so when I am in a situation where I'm in a crowd, I am definitely not the one that dominates the conversation. Visual learners do also like to read. They like to write as well because those are visual formats for which they use to learn and transmit and communicate. Unfortunately, visual people, because they are visual, have a terrible time remembering names, and I'm one of those people too. Now, if I can associate that name with a face, I'm a lot easier at remembering them. So if they have a name tag right there by their face, I am more likely to remember them because I'm looking at their face. Another learner is kinesthetic. These are the people who like to do things. They are not ones for sitting around. They don't like to stand in lines. They don't like to read directions. They don't like to read. They don't like to write. They want to do it. They are the experiential learners. Once you know what your preference is, you can actually use that and maximize that information, that way of learning, to help you to remember things much easier. So what type of learner are you? Are you the type of person who needs to read the directions from the very beginning to the very end before they even begin? I would say that that's probably the visual person. Or are you the person who likes to read aloud or have somebody else read it to you, the directions aloud to you? That person is going to be the auditory learner. Or are you the one that doesn't even bother looking at the directions? They just start pulling out the items of a kit that they want to put together and try to figure out where this screw is, where does it need to go, and maybe later out of desperation they might read the directions, but that's not going to be their first choice. The auditory learner is the one, as I said before, is going to lead the conversation. They're also the one that are going to learn the words to a song much more easily than the other two. And they are not going to be able to read body language very well. Keep those ideas in mind when it comes to remembering. What is it that I need to do to help me to remember? Another one is, let's say that the auditory person has trouble hearing, or maybe they can hear very well, but there's a lot of background noise and they cannot hear a conversation well, they can't hear, let's say, a teacher lecturing, whatever the situation is, they cannot hear it. Do you think that that would impact their memory? It most certainly would. Another one is the visual learner, which we've talked about as well. Those are the ones who are going to watch the face as they have a conversation with somebody. They're studying the face, they're studying the body language, and they're storing that information for reference later. But again, if they do not see maybe the name of that person written down, they're going to have a much more difficult time remembering the name of that person. If that visual learner is having trouble seeing, maybe they're blind. And that would be a disastrous, wouldn't they? Because that's their style of preference for learning. Or maybe they have eyeglasses and the eyeglasses have broken and so everything's blurry. Do you think that would impact their ability to remember something? It most certainly would. Here's an example of how auditory and visual learners might study something. And you have probably seen this sentence before. The key to this is counting the number of F's in the sentence. And the sentence goes, finished files are the result of years of scientific study combined with the experience of years. Now, if I were a visual person, I would definitely need to see that sentence. Having heard it being spoken out loud is going to be very difficult for them. And if they try to count the number of F's, they may come up with 2, 3, maybe 4 F's. But if they can see that sentence, then they can take a look at each word, find the F's, count them up, and find out that there are 6 of them. But if they're hearing it, then there will be some words such as of. That word of sounds more like OV rather than OF, so they're more likely to miss that F if they had to count it simply by hearing it. Where an auditory person is more likely to catch it. They would be more sensitive to the reading of that sentence. There's a kinesthetic learner. We've not talked about that. That person is one that's more likely to want to follow their finger along that sentence and find those F's and count them out. So the kinesthetic learner is the one that likes activity. They're experiential. They don't want to stand around, sit around. They need to touch and feel things. They need to experience the hands-on activity rather than learning through hearing or seeing. Let's take a moment and we'll come back and talk a little bit more about how auditory, visual, and kinesthetic people use those particular qualities to help them to remember.
Safety at a peace of mind price. Nex-Tech Wireless introduces the Simple Starter Plan. For only $20 per month, you can rest easy knowing you can always reach your child on their smartphone. The plan includes unlimited calling, unlimited texting, and unlimited data while on Wi-Fi. You won't have to worry about data overages, and your child will enjoy all the benefits of a smartphone. It's the Simple Starter Plan from Nex-Tech Wireless. Unlimited talk, text, and data while on Wi-Fi for only $20 per month.
Get more of the potential you plant with the latest from 360 Yield Center. Unlock trapped nutrients and speed residue breakdown with 360 Chain Roll. Prevent root-restricting berms to give roots access to potential-boosting moisture and nutrients with 360 Bullet Ripper Points. And capture more yield at every harvest by reducing header loss by 80% with 360 Yield Saver replacement gathering chains.
Your house is more than just a house. It's a home for your family to grow. It's a place where you feel the most comfortable and can be yourself. Shop at Paul's Furniture Company in Selden so your family can select the perfect pieces for all the rooms in your house. With over 17,000 square feet of selection, they are sure to have the styles that will please everyone, even the kids. Visit Paul's Furniture Company in Selden, where they'll help you feel at home. Visit us online at paulsfurnitureco.com.
Here in the Heartland, we make things homemade with precision and care. Robin Insurance is no different. Their family creates tailored plans to keep your family safe. They are a family-owned and operated agency that also offers commercial, farm, and crop insurance. With quick, fair claims, your matter will be held professionally and with excellent customer service. Robin Insurance, the corner post of insurance since 1936. See their ad in the Nex-Tech directory.
Let's take a look at the auditory, visual, and kinesthetic learners and how they might take in a learning situation. Here you'll see a map, and maybe the instructions are to determine how many states in the United States begin with the letter M. The auditory learner is more likely to go through the names in their mind and say it. They might say it out loud or they might say it in their mind, but they're going to say it out loud. They might even put an emphasis on the M, as in Maine, Massachusetts, that sort of thing. The visual learner is going to want to actually look at the map. They're going to look for the M and then start counting up those M's. The kinesthetic learner is the one that's going to need that map too. They're going to take their finger and they're going to go over each one of those states, and when they find a state with an M, then they can do their tally marks. So those are 3 different ways that we learn. And for those of you that want to know what those states are, they happen to be Maine, Maryland, Massachusetts, Michigan, Minnesota, Mississippi, Missouri, and Montana. So why can't I remember? Sometimes we have problems with recall, and as I said before, with crystalline intelligence, that information's there. It's accessing it that's the challenge. How do we retrieve it? Or why do we have troubles retrieving it? Well, part of that might be you might be on prescriptive drugs, and the particular drug that you're on may be a depressant, or it may have alcohol in it, like a cold medicine, and that is going to make your memory not as fluid as what you would like, a little bit slower. Or perhaps you're not eating right. Now remember, nutrition is very important because it is the building blocks for the chemicals within our brain, the chemicals that our brain needs in order for the brain to function properly. And if they're not there, then you just are not going to be able to either access that information or access it as quickly as you would like. Another one would be emotions. Anytime you go through an emotion, whether you're ecstatic and happy or sad and lonely, maybe you're under stress, maybe you've lost somebody close to you, or maybe you're very depressed about a certain situation and you're having trouble finding resolution. All of those can have an effect on how well you retrieve the information in your mind. Perhaps you're having trouble sleeping. Sleep is a time where our brain needs to help clear out the cobwebs, so to speak, all that unnecessary information. And if you're not getting sleep, then you may not be able to process the information as well as you probably would had you been able to sleep well. And habits are another way. If you have poor habits, such as just laying down your car keys anywhere, you're going to have trouble finding where was that last time that I set those car keys down. So you can develop habits, such as when you walk into the house, always have one certain spot where you lay those car keys, and you'll always find them. You won't have to worry about where did I lay those car keys and then not feel bad about having a poor memory. Sometimes we have habits of drinking coffee. I don't know if you've ever done that, but coffee is a stimulant, and there's other foods that we eat that may mimic those chemicals in our brain, whether it's a depressant or a stimulant. And those particular food items will mimic a brain chemical and either enhance our memory or slow down our memory. So the best thing to do to help you to remember is to utilize all 3 learning types, even the ones that are not those of your preference, and also to exercise your brain to improve memory. Exercising our brain is the same as exercising our body and improving our function. How can we do that? We can do that with word games, brain teasers, using different methods of looking at something, having conversations, socializing, and going through continuing education. An example might be having a crossword puzzle. I know a lot of people like to do crossword puzzles, and that helps to keep the brain healthy. But if that's the only thing that you do, sometimes you may need to find a new way to do something, either a new game, and there's lots of them on the internet, or accessible through our smartphones. Or you can still do, say, the crossword puzzle, only do it differently. So if you are, say, a right-handed person and you do your crossword puzzle with the right hand, change the pencil to your left hand. Do it a little bit different, and that helps you to expand the capabilities of your brain, to exercise it even more so. So in future sessions, we hope to cover strategies. What are some other things that you can do to help you remember and not feel so bad the next time you can't remember that person's name? Thank you for this time, and I hope to see you again soon.